If you've got vertical nail ridges, this is the video for you because today we are going to be talking about what causes vertical nail ridges, and I'm going to be giving you some practical tips and tricks for how to get rid of vertical nail ridges once and for all so you can have smooth, shiny, strong, healthy nails. The medical term for vertical nail ridges is onychorexis. Longitudinal ridges can be superficial or quite deep ridges. Longitudinal ridges can occur as an isolated finding, or they can be accompanied by other nail changes, such as nail pitting or horizontal splitting of the distal tip of your nail plate. Vertical nail ridges are a consequence of factors that disrupt nail plate production or are directly harmful to the nail plate itself. Now, a normal healthy nail plate consists of approximately 25 layers of tightly packed keratinocyte cells. It's roughly anywhere from 0.5 to 1 millimeter in thickness with a smooth surface. Many things are required for healthy nail growth, but one of the critical factors is good blood flow. Underneath the nail plate, you have all of these blood vessels that are important for the health and integrity of the nail. That's important as we get into the different causes. You will begin to understand how important good healthy blood flow is for nail growth. So why might you have vertical nail ridges? One of the most common reasons for vertical nail ridges is something called the brittle nail syndrome. There are a variety of reasons why someone might develop brittle nail syndrome, but it appears to be most common and most likely in middle-aged women. It's thought to be related to the fact that the intercellular bridges between the keratinocytes comprising the nail plate of women are much weaker in comparison to men. After menopause, the lipid content of the nails starts to drop, and you may also have a drop in water content. These factors together likely explain brittle nail syndrome, which exclusively affects the fingernails, not the toenails. You can also have vertical nail ridges secondary to a primary skin condition, such as atopic dermatitis, eczemas, psoriasis, lichen planus, lichen striatus, Dray disease. The autoimmune hair loss disorder, alopecia areata, commonly affects the nails as well, and that might be a reason for vertical nail ridges. You can also develop vertical nail ridges secondary to a fungal nail infection. Now, I said this before, and it's important to remind you all that fungal nail infections of the fingernails are not very common. If you go to a doctor trying to get to the root cause of your vertical fingernail ridges, and they tell you just by looking at it that it's nail fungus, get a second opinion. Nail fungus of the fingernails is very rare. More likely than not, you have something else going on. At the very least, before coming to that conclusion, they would need to do some sort of fungal evaluation, like fungal culture, a KOH prep. So don't just take that diagnosis at face value. It's most likely incorrect. But if you have vertical nail ridges on your toenails, it could be a sign of toenail fungus. You can also develop vertical nail ridges secondary to an underlying medical condition, a health problem, such as anemia. If you have anemia, your blood is not so great at delivering oxygen where it needs to go. And that's going to show up in the formation of vertical nail ridges and other signs and symptoms, probably of brittle, fragile nails. If you have arterial sclerosis, this also can lead to vertical nail ridging, as it impacts blood flow. People with underlying thyroid disorders, namely hyper or hypothyroidism, commonly have vertical nail ridges. Turns out it takes a lot of energy to grow a strong, healthy, smooth, shiny nail. So guess what's important there? A balanced, healthy diet. If you have any underlying vitamin, micronutrient deficiencies, you've been going on a lot of crash diets, it will show up, not just in your hair, but in your nails. One way in which it may appear is in the formation of vertical nail ridges. Certain medications can impact the nail and lead to vertical nail ridges, namely chemotherapy. As a side note, if you're about to go through chemotherapy, check out my video on skincare during chemotherapy. I give a lot of tips and tricks in that video. Another very common under-recognized reason for vertical nail ridges is something that is traumatic to the nail plate. This is most often seen in people who work with their hands a lot, especially people who are doing a lot of what we call wet work and experiencing frequent re-wetting of the hands. Maybe they're exposed to a lot of surfactants, detergents in their workplace, in their occupation, or maybe as it relates to some sort of hobby, and this can be quite harmful in the long run to the nail plate itself and lead to vertical nail ridges. Along the lines of traumatic things to the nail that lead to vertical nail ridges is manicuring practices. Aggressive filing, buffing, pushing back, and clipping the cuticles all can lead to vertical nail ridges. Grooming your cuticles is not necessary, and in most cases it is actually harmful to the integrity of the nail plate in the long run. Many nail cosmetics, such as gel manicures, can end up drying out the nail plate quite a bit and leading to vertical nail ridges. Keeping the nails long can make them more vulnerable to trauma, getting snagged on things, and ultimately that can lead to the formation of nail ridges. Not to mention, the longer your nails are, the more prone to dehydration they become, and with a drop in water content from the nail plate, you can get vertical nail ridges. All right, so those are some of the many reasons why you might have vertical nail ridges. So how do you go about correcting this issue? What can you do to improve the health of your nails? First and foremost, treat and control any underlying health problems, skin problem that is leading to the formation of vertical nail ridges and negatively impacting the health of your nails. If you have a thyroid disorder, that needs to be treated first and foremost before you can even begin to consider improving the health of your nails. If you have some underlying micronutrient deficiency, discuss with your healthcare provider how best to address that. So I mentioned that eczema is a common reason for you to end up developing vertical nail ridges, especially bouts of hand eczema. It kind of ties into why people who do a lot of wet work are also more vulnerable, not just through the trauma of their occupation to the nails, but also they are at risk for an irritant hand eczema. Check out my video on why you have hand eczema, because I give a lot of tips and tricks on how to control that, which is very important if you are developing vertical nail ridges, because those tips and tricks will help control the hand eczema and help allow for your nail to recover. The second thing to do is to limit contact with water and detergents that dry out the nail plate and compromise the lipid content of your nail plate, leading to vertical nail ridges. If you work in an occupation that requires you to do wet work, to work with your hands using things like detergents, make sure you always wear gloves to protect your hands. Likewise, just doing basic housework, chores, use gloves whenever you are working with any kind of cleaning product, whether it be a surface wipe. Keep your hands protected. Don't touch that stuff with bare hands because it can cause a hand eczema quite easily and impact the health of your nails. The third thing I want to address is dietary supplements. It's no secret there are so many dietary supplements out there claiming to give you great skin, hair, and nails. Are they worth considering if you've got vertical nail ridges? So when it comes to dietary supplements for improving nail health, nail growth, and of course vertical nail ridges, there are scattered small studies with numerous limitations for a variety of different micronutrients, vitamins, etc. Check out my video talking in detail about supplements for nails, because I go over all of the research. That amount of information is too extensive to cover again in this video. It would go on too long, so I want you to watch that video next. Number 4 is to get yourself some petroleum jelly, plain Vaseline. Don't waste your time with the cuticle oil. Cuticle oils, they can soften dry, rough skin a bit, but they're not going to offer your nails what petroleum jelly can. And what is that? Petroleum jelly is the best occlusive. It helps to protect the skin around the nails so as to limit access of water and debris up under the nail folds that compromises nail growth. And it also helps to improve water content in the nail plate itself. Even better, get yourself some gloves, apply petroleum jelly to the nails, and cover with gloves. This really can maximize efficacy. Do this in the evening time, say after you get out of the shower. Leave the gloves on as long as you can tolerate, and if you can sleep in them, even better. Number 5 is to use a nail treatment with either alpha hydroxy acid or urea, or a combination of both. Now, alpha hydroxy acids are a family of ingredients that include glycolic acid, lactic acid, and mandelic acid, and then urea is just something that is naturally found in your skin. These ingredients are actually really good for the nail plate. They help to improve the water content in the nail. One product I often recommend that works quite well for the nails is Carousel's nail lacquer. It's basically a lacquer that has urea and alpha hydroxy acids as well to improve water content in the nail plate, painted on the nail, underneath the nail, and it really can rejuvenate the nail. Number 6 may not be desirable to you depending on how you like to fashion your nails, but keep them trimmed short, especially if you are in the midst of trying to recover healthy nail growth. Just keep them trimmed short. This does a couple of things. First of all, it cuts down on nail dehydration. Second of all, it cuts down on nail trauma. If you have long nails, the tip is more likely to get caught up on something, to ding something. That can transfer that force back to the nail matrix and disrupt healthy nail growth. So keep them trimmed short. Number 7, lay off of the aggressive manicures. Don't trim or push back your cuticles. This is not good for your nails. This is a common reason why women develop vertical nail ridges. Pushing the cuticles back, trimming them, there's no reason to. Remember, that is delicate, healthy skin that is there to serve a function. And if you cut it back, you push it back, not only can it impact the health of the nails negatively, but it also opens up that area for moisture to get trapped up under there. That can trigger a hand eczema, irritation, and allows for bacteria, fungi to grow and cause nail infections. So I don't recommend doing that. Lay off of it, especially if you are trying your best to improve the health of the nail plate. And my final and probably most important tip when it comes to considering all of these tips together and implementing them into your life is to be patient. It takes a while to grow out the nails. You're not going to change the appearance of your nails overnight. It takes at least 6 months for the nail to grow out. So patience is key. All right, guys, that's a wrap up with regards to vertical nail ridges. I really hope this video was helpful to you guys. On the end slide, I'm going to put my video on nail supplements. I really want you to watch that one next because it can be so tempting to try out all of these hair, skin, and nail gummies, and a lot of them are just smoke and mirrors. But if you want to know what the actual science is behind some of them, I do cover it in that video, so watch it next. But if you like this one, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!